Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. American children are dying at rates far exceeding those in other wealthy nations, with a new study showing that U.S. infants are about 80% more likely to die before their first birthday, and children overall face an 80% higher death rate than their peers in 18 other developed countries. The comprehensive study, which examined health trends from 2007 to 2023, reveals that the U.S. experiences an excess of 54 child deaths every day, compared to what would be expected if America matched the mortality rates of other wealthy nations. For infants, premature birth and sudden infant death syndrome drive the higher mortality rates. Among children ages 1 to 19, deaths from firearm injuries and motor vehicle crashes far exceed those in other developed countries, with firearms now representing the leading cause of death for American children. However, the crisis extends well beyond mortality. The study, which analyzed 8 major data sources including national mortality statistics and large-scale health surveys, found deteriorating health across every measured category. Over the 16-year period, this daily toll remained consistent, underscoring the systemic nature of the crisis. Chronic conditions have surged. A child in 2023 was 15 to 20% more likely to have a chronic disease compared to a child in 2011. The proportion of children ages 3 to 17 with at least one chronic condition rose from about 26% to 46%, a nearly 20 percentage point increase. An obesity epidemic has taken hold. Today, 1 in 5 children is affected by obesity, and 1 in 7 girls begins menstruation before age 12. The share of children ages 5 to 17 experiencing at least one physical symptom, such as poor sleep, chronic pain, activity limitations, increased from 20 to 30%. Mental health has deteriorated sharply. Depressive symptoms have risen at an alarming rate, with nearly 40% of high school students reporting persistent feelings of sadness or hopelessness by 2023. Despite spending nearly twice as much on healthcare as other high-income nations, the U.S. continues to see worse health outcomes. The editorial accompanying the study noted that Americans have long had poorer health compared to other wealthy countries, and though this was previously mainly seen in adults, it has now spread to the pediatric population. Prematurity rates in the U.S. are at historic highs, driven by maternal chronic conditions like diabetes and pre-pregnancy hypertension, unhealthy weight, smoking, alcohol, and substance abuse. 93% of U.S. adults are metabolically unhealthy. Can you imagine? These numbers are staggering, reflecting widespread chronic disease and poor metabolic health. Every year, 1 in 10 to 1 in 20 pregnant women in the U.S. develops gestational diabetes. The U.S. also has the highest chronic disease burden and an obesity rate nearly twice the Organization for Economic Cooperation and Development average. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.